You're listening to the Doctors In podcast from martinclinic.com. Although we share a lot of practical and, in our opinion, awesome information, what you hear on this podcast is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes. So enjoy. Hello, I'm Dr. Martin Jr.
I'm Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 186. Now, I'm back after taking 1 week off. You did it by yourself last week.
Yoo-hoo!
You even got through the technology okay. I mean, it was pretty simple, right? Just start and stop. But But you did it. That's like 80%. If there was a Vegas house odds, I would have bet a lot of money that you would have talked for 30 minutes and there would have been nothing on the tape.
I was sure of it. The thing is, you can't check and see.
No, you can't. Once you're going, you have to commit to it. You have to go. But I would have been willing to bet money that it would have came back and you would have been all proud of yourself and you would have handed me the unit and I would have taken the little memory stick out of it, put it in the computer, and it would have been blank.
Yeah, I was shocked when it worked.
Yeah, awesome. I mean,
I would have taken I would have bet with you.
You would have bet against yourself. But anyway, so you did it last week on your own.
Yeah.
And so we're back this week again, episode 186, and today we want to talk about omega-3, but specifically DHA. Now, I guess the thing that we should do first is explain what DHA is, and one analogy that I like to use for people is that if you know, there are a lot of different types of cars out there, right? There are a lot of different types of cars. And you look at, there are Hondas, right? Toyotas, Kias, and Porsches, and BMWs, and so omega-3s is like saying a car, right? It's a generic term that can mean a lot of different things. And DHA is like saying it's a Honda. So it's a car, but it's a Honda. Or EPA is like saying it's a Toyota. So that's when we talk about DHA, we're talking about an omega-3 fatty acid, but we're talking about a specific one. So the conversation we're going to have today is around a specific omega-3 fatty acid, which is DHA. And we love DHA, and we like EPA as well.
Yeah.
But based on the stuff that we experience, we like DHA better because most people are significantly decreased in DHA. And we know that the brain is mainly fat, and DHA is the preferred source of fuel for your brain, and it needs a lot of it. Right, so people just don't get enough of it. So we're going to talk about DHA, and there's a couple of...
and one thing, too, just about DHA, it's really only found in the animal kingdom. So when you have a fish oil, right, that's where you would source your DHA because EPA and DHA are byproducts of animal fat, right? So fish oil or even grass-fed beef or whatever would have high levels of DHA. And whereas in the plants, you do get omega-3s, right? There are omega-3s in the plants, like flaxseed, for example, would have omega-3, and hemp seed has omega-3, but they're different. They don't have that DHA.
No, and they tend to have more omega-6s as well. Mm-hmm. And that's why we like it, because people just don't get enough fish, obviously, and some people don't like fish. So they don't get enough DHA, which means you have to if you don't get enough in your diet, you have to supplement. And we're going to talk about why, why we love DHA and why people who take enough DHA, because that's another issue as well, they feel fantastic, right? A lot of studies that every once in a while, I mean, we have a fantastic private Facebook group, and I like it because a lot of people ask us what our opinion on different things that come out. Hey, you'll see in there a lot, hey, what does Dr. Martin think of this, right? Or what does Dr. Martin think of that? And a lot of times a study will come out, and first of all, there are no worse studies than nutritional studies. No. They're all based off of these questionnaires. They're terrible. They're no good. Most of them are garbage. Even the ones that will show good things, a lot of times the study is garbage. And, you and I were talking over lunch today about research, but also how research is a lagging indicator. The stuff that we see in the clinic happens years really before they start to test it in labs. Does it mean that before they do it in labs it doesn't work? Of course not. Because the fact, and this is the thing that you and I are talking about today, which we found interesting, the fact that this stuff is still around today tells you it works.
Yeah.
Because the whole system is set against it, right? You look at the agenda of big food companies, big pharmaceutical companies. DHA is not a drug. You get it in fish. You get it in fish oil capsules or liquid. Yeah, there's nothing. It's just, that's what it is. So it's not a drug. And the fact that nutrition, especially supplements, are still around today tells you that they work, because people would take them, because it's not like they're getting good press. It's not like their doctors like it.
Yeah.
It's changing for sure. But there was a time when not many family doctors, people would lie about, they wouldn't tell their doctors they're taking a supplement because they're worried about getting lectured about taking a vitamin C.
Mm-hmm.
No problem taking any drug on the planet, but heaven forbid they're taking vitamin C and vitamin D. And it's like, ooh, you better.
Yeah, watch out.
You'll get a lecture. Mm-hmm. I remember years ago getting a letter in the mail from a physician who was upset because, their patient was taking vitamin C. And that we've come a long way from that, obviously. But
yeah, because the internet and even what stuff that we do.
And the doctors take it and they feel better themselves.
Yeah.
I mean,
and there isn't a doctor, there isn't a cardiologist that I've ever met that doesn't take Omega-3. They take it.
Yeah,
they take it themselves. Whether they recommend it, that's another issue. Because they're always hesitant to recommend it just because they've never done any work with it.
Well, and they're bound to what they call the standard of care, which is written. It's basically the law, and they get in trouble if anything ever goes wrong. And they went outside of the standard of care, that's when they get in trouble, even by their malpractice insurance. Mm-hmm. So they hesitant to deviate very far from the standard of care. And, of course, pharmaceutical companies have a big hand in the standard of care. So, drugs, if you don't recommend a drug and something happens down the road, you could get yourself in trouble. And so that's why you're seeing more of it. It's not as scary as it used to be. But you're right. DHA is one of those things that doctors recommend. And DHA is also one of those things that, if we were to pick 4 or 5 things that we would say 80% of the population is low in, yes, omega-3 blood levels in people would be down below optimal. Low. All right, so that's a long way of saying we're going to talk about DHA today. We love it. We like what it does for the brain, but we're going to go through some other stuff that we found interesting. The first one specifically was looking at diabetic retinopathy and the damage done to the blood vessels as a result of the diabetic retinopathy, because one of the side effects of diabetes, if you will, is eye problems, because the eyes rely...
it's microcirculation, right?
Tiny, tiny, tiny blood vessels.
Yeah, they got a little highway. It's always interesting, when you were in school and, when you look in the eye, right? And, when you take the little instrument and the first time that you ever look inside an eyeball, it's always, you see a highway.
Well, and you always pretend you see what they're telling you to look at, right? They're always telling you, oh, you see that? You're like, oh, yeah, I see that. And you're like,
no, I don't.
I have no idea what you're talking about.
But what's always interesting is that you saw this. It looked like I don't know if anybody's ever been to Los Angeles, but you got about 8-lane highways, and there's about 50 of them.
Yeah, it's like a satellite view of Los Angeles, looking down on like Amazon or Google Earth, right?
Exactly.
It's
just all these highways going everywhere, but it's all blood supply.
All blood vessels. And each of those little capillaries are extremely important, and diabetes ruins them. Mm-hmm. Specifically, and we've talked about this before in newsletters, cholesterol is overrated. We talk more about endothelial damage, right? So endothelium is the lining
of the
blood vessels. And those lining, just like your gut lining, like a lot of linings in your body, can get damaged. And when they get damaged, that's where the problem is. Diabetic retinopathy damages. So part of the high blood sugar levels and high insulin levels of a diabetic, and the funny thing is this, and we've talked about this numerous times before, even if you are a diabetic and you control your blood sugar via insulin, you're going to get diabetes of the eye, diabetic retinopathy of the eye, because the underlying problem hasn't been fixed, right? You're still requiring insulin. Mm-hmm. And at the end of the day, diabetes isn't a disease of high blood sugar level. High blood sugar level is a symptom.
You just don't process insulin.
No, it makes no sense that if you control the symptom, you're going to fix the disease. That's not how it works at all. So diabetes, a lot of the diabetic management, it only has to do with controlling blood sugar, right? The medications are around stabilizing blood sugar, and rightfully so to a certain extent, because high blood sugar level is deadly.
Yeah.
It's deadly. Low blood sugar level could be very deadly. So, maintaining a normal, stable blood sugar. But high blood sugar level is a symptom of diabetes. So the current treatment protocol or management, I don't want to say treatment because they don't treat it, they manage it. The current management protocol diabetes is given insulin, control blood sugar levels, but they still end up with eye issues. They still end up with diabetic retinopathy of the eye. And because, as we mentioned, the underlying issue is not fixed. But high circulating insulin, high blood sugar levels destroys the endothelium in the blood vessel. It destroys the inner layer of the blood vessels. That affects the blood flow, and that, in a sense, the blood flow decreases. Then the eye, diabetic retinopathy is, one way of looking at it, the eye just ages very quickly.
Yeah. And so does, they're much more susceptible to same diabetes because, again, of what it does to. Anytime you talk about eyes, like the first thing that comes to my mind is blood vessels, and it's always circulation. It's microcirculation. So guess what glaucoma is?
Yeah.
Guess what cataracts are? It always has to do with what's going on in the highways.
Free radical
damage. The highways
damage
are blocked.
That's right. If you look at the ways that the blood vessels get destroyed in the eyes, probably the top 3 causes of all those conditions you just mentioned are messed up blood sugars, messed up insulin, and free radical damage, which ultimately destroys the endothelium as well of the eyes. Those things age the eyes faster. So, we've got a lot of requests over the last little bit to talk about the eyes. And, we'll do a good video teaching on the eyes. But if you boil it down to the big 3 things that really hurt the eye as you age, are the 3 things you got to watch out for. It's those 3 things ultimately cause that. Yeah. If you can keep your blood sugar levels stable, if you can keep your insulin levels low, and you keep your free radical damage low, your eyes generally will be pretty healthy. I mean, unless you stick something in it, like your mom said, don't run with that, the pencil sticking up. But for the most part, your eyes will be pretty good. Yeah. So let's go back to this study, was looking at diabetic retinopathy, and what they found, and this is what was interesting, is they were fed a DHA-rich diet, and I'll just read you the results. They found that it prevented diabetes-induced increase in the number of retinal. So they basically, what they found, because I don't want to read all these big words. It's hard on me to read them anyways. But what they
found.
Hard
on your eyes.
Yeah, so a DHA-rich diet basically fully prevented retinal vascular pathology is what they're saying, which is amazing to think about, right? So DHA, and you think about why that is. How can DHA, an omega-3 fatty acid, help eye health? And they go down to the very basics again. Your cell walls need fat, and endothelial cell walls need fat, and DHA repairs the damage in those little endothelial cells. So basically, DHA can repair the lining or protect the lining of the eye.
Yeah. And
you and I, for eye health, really like DHA, high DHA, and obviously pine bark extract, because pine bark extract is tremendous for the endothelium cell, even for blood vessels to the heart, and we like that. We'll do that on another episode. But
combine the two.
Yeah,
it's a tremendous way to have healthy eyes is to combine those 2 things.
So again, if you are worried about retinopathy, you may want to look at increasing omega-3 fatty acids. So that's one study. Here's another study. We'll shift away from the eyes for a second because we are talking mainly about DHA. This study looked at the effect of DHA on inflammatory levels in the liver specifically, because again, the liver, we talked about this a few episodes ago. It's not a filter, right? People think it's like a car filter. That's not what the liver is. Toxins don't get trapped per se in there. A good detox doesn't like take a hose to the liver and filter it. That's not what's going on. That's not how it works. But when the liver has issues, there's fat. We talked about fatty liver. When the liver has issue, it's not producing something called glutathione,
which is your master detoxer.
Yeah, glutathione. If you always think of It's sulfur-based, so it's sticky, right? The reason why you
Velcro.
the reason why you make glutathione is it's very sticky, and that goes throughout your body, and bad things stick to it, and then it's then taken out of your body. So it's like a natural chelation to an extent. And there's a correlation between disease and decreased glutathione. For a while, that was really big in nutrition, where getting glutathione just to increase your glutathione levels. Fascinating stuff. But at the end of the day, when you have an inflamed liver or a fatty liver, that's bad news. And I would encourage you to go back and listen to our episode just a few ago where we talked about fatty liver, just to show how dangerous that can be. But this specifically, they looked at fish oil on fatty liver. But what's interesting about that, not fatty liver, sorry, inflamed liver. But I want to talk about a few of the benefits that they found specifically on this, all right? So they found a decrease in oxidative stress, which, again, free radical damage, right? So it had a protective. A decrease in inflammation markers, increased telomere length. Now, that's telomere lengths are interesting. We always tell people, think of telomeres as the candle wick. The longer the candle wick, the longer the candle's going to burn for. Well, the telomere, that's the little tips in right down at the cellular DNA level. The longer your telomeres are, the longer you're going to live.
Yeah.
Short telomeres equal short life. Basically, you want longer telomeres. Anything that cuts the telomere length is not a good thing. Anything that protects or adds telomere length is a very good thing. And there's, research is looking more into that, the effect of that, but it's very...
What increases it? What decreases it?
Yeah, it's very interesting. But what they found was when you have inflammation of the liver, you ultimately have shorter telomeres because that's not a good thing. Your candle's burning faster than it should.
Yeah, you're going to age very quickly and die younger.
Exactly. And what they found was, again, fish oil protective of that, protects the telomere length. Also looked at a few other things. Age-related gene expression. I mean, it helped, again, the epigenetics of, right? There's a we always talk about genetics and epigenetics. It's amazing all the stuff that DHA does, even for longevity. And there are studies, again, looking at blood levels of omega-3 fatty acid and a person's mortality rate, right? Just like there is for vitamin D. Generally speaking, people that have a higher level of omega-3 fatty acids in their blood generally are healthier. They got a healthier brain. They got less inflammation. They got lower cardiac markers. Generally, they're healthier. So when somebody comes in and they got low omega-3 fatty acid levels, you know that they are heading down the wrong path. There's no question, right? So that was another study on fish oil that's an interesting. Now, we'll go through, because we're moving along quickly here, but I just want to go through a couple other studies just to talk about why we like DHA so much. Now, in our presentation, you can get on our website, Age Proofing Your Brain. We talk about some of the benefits of DHA because we love omega-3 fatty acid for brain health. So we talk about that, but there are a few studies I just want to mention here quickly. Let's talk first about the effect that DHA has on the brain, right? One of the problems that happens as you get older is your brain
shrinks,
gets smaller. And there are certain lifestyle factors that shrink your brain faster. We wrote a newsletter about a month ago about Bonnie and Clyde, because that movie came out. We talked about this on a podcast. And the Bonnie and Clyde for your brain is midlife inflammation, but specifically high blood sugar levels, midlife high blood sugar levels, midlife high blood pressure that causes inflammation of the brain, and your brain will shrink faster as you age. So again, DHA is one of those things when you're low, and they've tested this. People that have chronically low omega-3 levels generally have faster brain atrophy as they age.
Yep.
So it's interesting.
Yeah.
So if you want to, and here,
so there you go. You come back to your diet again, right? You come back to the importance of getting this omega-3 rich DHA into your diet. If you don't eat enough fish, you don't eat enough grass-fed beef, you better be taking a supplement of DHA.
And taking enough of it. And we'll talk about that at the end, why that's a problem, why people, they just don't get enough of it. And we'll talk about the couple of reasons why that is. So it's very, very good for cognition. Quickly, like you mentioned, most cardiologists will take a fish oil themselves. And if you look at what DHA specifically, we're going to talk DHA, the research on DHA, specifically what it does for your cardiovascular system, right? So when you have higher levels, and this is a study that was done showing that when you have higher levels of DHA in circulating blood markers, such as what they call serum phospholipid, you have a reduced risk of this: progression of coronary atherosclerosis, lowered risk from sudden cardiac death was 2 things. Those are good things, right? Also, there was another study done on so people that have had a heart attack, and they found there was a substantial reduction in the risk of a sudden cardiac death when they increased their blood levels of omega-3 fatty acid. So again, it's so good for the heart. We already know it protects the endothelial cells, our lining in your blood vessels, your eyes, so you know it's doing the same thing for the blood vessels.
Yep.
So it's so good for your heart. It's so good for your brain.
Good for your eyes.
Tremendous for your eyes. We didn't talk skin. DHA for your skin.
We didn't talk kidneys. Because whenever I always look at the kidneys too, very similar to the eyes, right? In that sense, why are diabetics so susceptible to kidney disease? And again, it comes back to circulation, right? Because your kidneys don't function without that microcirculation. All the blood supplied to the kidneys, and that gets damaged, and your kidneys, now your kidneys are not working properly, and that can elevate your blood pressure, and that can cause toxins to stay in your we could go on for days about the importance of kidney health. But again, there's another reason to be taking the DHA oil. And
it's funny, we've heard this from a lot of people, and we've seen this effect as well. There are a lot of people that would say after getting enough DHA that their bladder works better. And we've noticed that also in kids who wet the bed when they get their omega-3 levels up high enough. Mm-hmm. It seems to help. I mean, it's not going to cure everybody, but we've heard that enough, and we've seen variations of that enough that we cure that. So it's interesting. So there is some kind of connection, again, between the health of the bladder and, increasing getting enough DHA. Yeah. And how many people over the years have had their joint health improve significantly when they take more DHA? Yeah, because, again,
it's a tremendous anti-inflammatory.
Yes, joints, I've heard you tell people that when they got a lot of joint pain to take enough DHA that they slide in and out of the room, right? Yeah. So it's funny. I've heard you say that many times. But so, again, there's a lot of reasons why we like DHA. Specifically, if you go back a few episodes ago, we talked about the ratio between omega-3 and omega-6 fatty acid. And obviously, when you increase your DHA, you're increasing your omega-3 fatty acid. So you're bringing down that ratio, which, again, is so good for your overall health and mortality. So there's a lot of reasons why we're big fans of DHA. Now, let's end off this episode by talking about why people don't get enough of it. And there's a few reasons for that. One is they're taking an omega-3 fatty acid supplement, and the bottle says there's 1 gram of fish oil per capsule. So they take 2, and they get I'm getting 2 grams. But they're not getting 2 grams of DHA. Yeah. If you actually look in the ingredients in the back, a lot of times if it's 1,000 milligrams or a gram of fish oil, they're lucky to get 100 to 150 milligrams of DHA. Yeah. So if they're taking 2, they're getting 300 milligrams of DHA every day, which is not enough. It's not enough. A lot of fish oils are constructed with a little bit of EPA and a little bit of DHA. So if you add those two together, they're not even getting 300 milligrams. So it's not enough. Specifically, those are the 2 that we like to see in a...
Yeah. You need to take therapeutic doses. Like I always tell people, look, we live in a different world. We live in, the reasons of that we live in a world where people, meat has been vilified and so is fish. Well, I had a patient in this morning that actually told me I don't eat fish because of mercury. I said, well, okay. And they're more scared of the mercury than they are worried about
not getting any.
Not getting enough fish in their diet. And I said, well, okay, we don't live in a perfect world. I understand. I don't like mercury any more than you do. But I'm so concerned about you not getting enough omega-3. So you need to replace it with a supplement And I recommend, because of what we know, just even for what you have mentioned today, like reading these studies, isn't that enough reason to take a therapeutic dose of it? Because, like, if you want your brain, your brain is made up of that fat. Your brain doesn't work without fat. And now we talked about blood vessels around the eye, and we talked about the liver, and we talked about kidneys, and we talked about your heart. Therapeutic doses of DHA is something that the Martin Clinic talks a lot about, because you don't have to take 1,000 things, but this is one thing, and the science is clear, and there's nobody disagreeing with the importance of omega-3 and especially high therapeutic doses of DHA oil. There's just nothing that replaces it in terms of what it does like you even talked about telomeres and, stuff that's, sort of new on the radar in health. I mean, what that does to your DNA and the repair, like telomeres, they repair. Your body repairs itself. But you need good doses of DHA for that to happen properly. So, folks, make it part of your supplement.
Yeah, it's foundational in a sense.
Foundational, it is.
It's one of those things. I look at certain things that I take every day as just foundational, right? Vitamin D, DHA, magnesium. Those are just like those things that we just don't get enough of in our diet, in our soil. So I just know that going into my day. So those are just foundational. I take a lot of other things, but that's just like, I'm not going to get enough of that in my day. I know that, and I'm just going to take that every day. Yeah. And they are, again, we can talk about this another time, but people say, well, if you eat the perfect diet, will you need supplements? Yes, because there's no such thing as the perfect diet.
Well, not in this day and age.
No, and because of the stress on the body from the air we breathe, the plastics, the chemicals, the lack of sun, the skin cream, everything, yes, which we'll talk about that another time. But again, this was an interesting episode because a lot of people do ask us about fish oil, about omega-3. There's a lot of confusion out there. And a lot of people just
read your labels, guys.
Yes, and they don't
read your labels.
They don't take enough of it.
Yeah,
they're like, I take a gram every day. Well, you're taking less than 300 milligrams of DHA and EPA. So we're not expecting a miracle, right?
Yeah.
All right.
And any study that's negative usually, and I just want to mention that.
Yes, you're right.
Because any of the studies, and you and I go over these studies and we look at them and go, well, no wonder.
Yeah, there was no effect on fish oil.
It's like somebody saying, well, vitamin D doesn't work. Well, how many units? Well, I was taking 400 international units. Well, a mouse can't live on 400
Well, and it's funny because
units,
a lot of the studies where they say fish oil had no effect or no beneficiary effect, they're taking like 1,000 milligrams plus. Again, we don't even know how much actual DHA and EPA they're getting.
It wasn't much.
No. And I've given this analogy before, but a study like that is like telling somebody to go to the gym to build muscle. Like this weekend in town, there's a big bodybuilding competition, right? And you can see them around town.
They bulked up.
They've bulked up. It's like telling those guys to say, hey, listen, go to the gym, do one rep, and then leave. And then they come back 6 weeks later. Hey, I've been going to the gym every day and I've done one rep and I'm not putting on muscle. Yeah, because you're not doing enough.
Yeah.
You're not doing, and it's the same thing with these studies. I could have told them not to do the study when they had the study design done. When they submitted the design, I could have told them, you're just wasting your time and money. Yeah. You're not getting a dosage enough to have any effect on anything. But that's another issue of mine when it comes to nutritional studies. They're just not doing things right. Or they'll do a low-carb study, and they're like, well, low-carb didn't, and you look at the study frame, it's like 40% carbs. Well, that's not, by nobody's definition is 40% carbs low. Yeah. Like it's just, anyways, that's the frustrating thing. But the headlines would say low-carb diets do this, or high-fat diets are no good because of this. But when you look at the study, they fed the mouse processed crappy fats and sugar and all these things, and then they say high-fat diets don't work like that. Like that's the same thing. But anyways, that's another pet peeve. All right, we're out of time, so let's close this episode off. We want to thank you for listening, and have a great day.
Thanks for listening to the Doctor Is In podcast from martinclinic.com. If you have any questions, you can reach us at info@martinclinic.com. If you're not a newsletter subscriber, you can head to our website and sign up for free. We also have a private Facebook group that you can join. It's a community of awesome people. Finally, I do a Facebook Live every Thursday morning at 8:30. Join us again next week for a new episode.